Module 2, classification of medications, medication preparation, administration, and documentation. Prescribed medications are those medications that a licensed practitioner has ordered for the treatment of a student's particular diagnosis or symptom. They include controlled, scheduled, or non-controlled, scheduled. They may be ordered routinely or as needed. Controlled scheduled medications such as Ritalin or Adderall are potentially addictive and therefore regulated. They can only be obtained with a prescription and must be strictly locked up. Document all administration and count with parent when received at school. This is very important with all controlled medications. Non-controlled or scheduled, such as antibiotics or Dilantin, can be obtained with a prescription. They must be kept under lock and key. Document administration and count the number of pills with parent received at school. Over-the-counter medications such as Tylenol, cough drops are customarily on an as-needed basis. The district requires medication permission forms to be completed for all over-the-counters. To review, parent signature is only good for 3 days. If a parent wants an over-the-counter medication kept at school for the entire school year, then a physician's signature would be required. Remember, with all medications, that many have a brand name and a generic name. For example, generic name for Advil is ibuprofen. Medication orders and prescription bottles may have different names for the same medication because a generic was given. If ever in doubt, contact a nurse for clarification. Currently, our district does not supply medications to students, such as Tylenol or Neosporin. We have this policy because we do not know all the allergies that could be involved with each student. Here is a website of common adverse reactions with certain medications. Knowing what to expect with your students following an administration is always beneficial for all involved. All medications have the potential of unwanted, unexpected, or dangerous reactions. Reactions can range from nausea and vomiting to redness, rash, or itching, or the most extreme, anaphylaxis, which is the most life-threatening allergic event. Emergency action should be implemented if anaphylaxis is ever suspected. Observing a student after a medication administration is important. Some medications have less side effects if given with food and are ordered after meals. If ordered that way, make certain the student did eat his or her lunch. If a student would vomit after taking the medication, report to the nurse the medication that was given and the interval between administration and when the vomiting occurred. Different forms of medications come to the school setting each year. They include oral, topical, inhalers, and emergency meds. All oral medications should be given with 4 to 6 ounces of water. After the student has received the medication, it is very important to make sure it was swallowed. Inhalers and emergency medications will be discussed later in Module 3. Tablets can be given many different ways. For example, chewable tablets are meant to be chewed before swallowing. Always follow the directions on the label. Some are scored and have a line on them, which means the medication is evenly distributed in the tablet and can be broken or split to reduce the dose. Unlicensed school personnel are not allowed to split these scored tablets. Always ask your parents to do this for their child, bringing the medication to school. Another form of oral medication is capsules. They are coated so that they will not start working until they reach the stomach or intestines. They are also capsules designed to be broken apart and sprinkled onto soft food, such as applesauce. These are called a sprinkle and are most often given to students with asthma or those that have seizures. Enteric-coated capsules are covered to protect the stomach from irritation. The coating dissolves in the small intestine over a prolonged period of time. Do not break or crush any medication considered a slow release, sustained release, long-acting, extended, or controlled release. These can be identified by the abbreviations EX, ER, CR, LA, SR. Cutting, crushing, or sprinkling of the medication are examples of changing the form of an oral medication. The prescribing healthcare provider will indicate this change on the label. In our district, we request that the parents or the dispensing pharmacist pre-cut all medications prior to bringing them to school. Some medications are light sensitive and are kept in a full liner. In these circumstances, and if the order is to cut the pill in half prior to an administration, then it would be permissible to do so as the unlicensed school personnel. Syrups and elixirs are clear liquids. Suspensions are liquids that are not clear and usually need to be refrigerated. Because the suspensions can separate, they always need to be shaken at least 15 seconds before being measured and given to the student. Topical medications include eye drops or ointments, ear drops or ointments, and creams and ointments that are applied to the skin. Please note, gloves should be worn when administering any of these medications. All gloves should be vinyl when supplied by the district to protect those with latex allergies. Handling medications. Before administering any medication to a student, always wash your hands for 20 seconds. Alcohol-based sanitizers are an excellent alternative to washing when soap and water is not available. Avoid touching the medication by pouring the pills, tablets, or capsules into the lid of the bottle. Then have the student pick up the medication themselves and self-administer. Medication administration. Here are the steps in administering an oral medication. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. With each medication we review, you will always end the medication administration with DRO. You will document, replace, and observe. With an oral medication, you will pour the medication into the lid, provide water, verify that it was swallowed, then DRO. Document the administration, replace the medication, observe the student. When you sign your initials and name to the MAR, then you are verifying that the child received the medication. When using a plastic marked medicine cup for liquid medication, place the cup on a solid level surface and look at the medicine cup at eye level to ensure the correct amount has been poured. If a student is to receive more than one liquid at the same time, each liquid medication must be measured separately. When pouring the medication out of the container, always hold the bottle so that the label is in the palm of your hand to prevent spillage and causing the label to be illegible. Here are some steps in administering a liquid medication. Cup at eye level on solid surface, label in the palm of your hand when pouring, verify that the medication was swallowed, DRO, document, replace, observe. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. Here are the steps in administering an eye drop or eye ointment. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. For eyes, ears, and topicals, you will always wear gloves. You will have the student lie down or tilt their head back for eye drops. Have the student look up. Form a pocket by pulling the lower lid away. Place drops in without touching the eye to the container. If it is an ointment, apply a thin strip into that pocket. Have student close their eyes, dab away excess. Remove your gloves, DRO. Document, replace, observe. Here are the steps in administering ear drops. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. Eye, ears, and topicals, you always wear gloves. Fill the dropper with the medication for ear drops. Tilt the head to the opposite shoulder. Pull the ear back and up and hold. Place drops without touching the dropper to the ear. Have student remain in that position. Remove your gloves, DRO. Document, replace, observe. Here are the steps in administering a topical medication. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. Eye, ears, and topicals, you always wear gloves. You'll put the medication on a Q-tip for a topical medication. Apply the medication. Cover that area. Remove your gloves, DRO. Document, replace, observe. Here are the steps in administering a nasal spray. This is what you will need to demonstrate when you come to the skills checkoff to complete your medication training. Have the student blow their nose, block one nostril with fingers, insert the nozzle into the other nostril, aim up and outward toward the ear, avoid aiming inward. Have student exhale, squeeze quickly and firmly, and the student inhale at the same time. Repeat if necessary. DRO. Document, replace, observe. SMD-RTD. SMD-RTD. These are the 6 rights of a medication administration. You will need to double, if not triple check these rights each time you administer a medication. For right student, you need 2 identifiers, photo on the MAR, and have the student state his or her name. If you are on a field trip and have no access to the photo, then confirm with another teacher that you have the correct child. For right medication, you will look at the label 3 different times: when you remove the medication from storage, when you dispense the medication to the student, when you return the bottle back to storage. For right dose, compare the label to the medication administration record or the permission form. For right route, make sure eye drops go into the eyes and ear drops go into the ears. For right time, we have 30 minutes before and 30 minutes after a timed medication is ordered. For right documentation, all medications administered by school personnel must be documented after it is given. This also includes all medications given on field trips. Failure to document or inaccurate documentation is a medication error. This might cause a second dose of medication to be administered, leading to an overdose. Reviewing the label is a 3-step process. It is to be viewed when taken from the storage, when removed from the container, and when returning to the bottle to storage. Never pre-set up medications that will be administered during the school day. This can lead to medication errors. If a student is to receive a medication during the school day, then it is our responsibility to make sure that happens. Develop whatever reminder system necessary to ensure appropriate delivery times. Record keeping is very important when a medication is given at school. A medication administration record, or MAR, is kept for every student that has a medication at school. Always complete the top of the form and you will have covered all the requirements. It is important to be aware of student allergies. However, in Bullitt County, we never administer anything not provided by the parent or guardian. Attach a student's picture to the MAR, either from Infinite Campus, take a picture of the student, or ask the parent for an updated picture. Each form is only good for one medication and one time of day. So whenever there's a change of either the dose or time, the student will need a new form. The old form should be placed in the student's cumulative folder. So a child receives Adderall at 9 a.m. and again at 2 p.m. How many MARs will he or she have, 1 or 2? The student would have 2 forms, one for the 9 a.m. dose and the other one for the 2 p.m. dose. On August 7th, the child receives 10 milligrams of Dilantin at 9 a.m. On October 12th, you receive a new form that states 15 milligrams at 9 a.m. What needs to be done? You will confirm that the label also states 15 milligrams to match your form. You will place first MAR and permission form in the cumulative folder, and you will start the new MAR. The MAR is a permanent part of the student's file and is considered a legal document. For inhalers that might be given frequently through the day, the district has a different form that can be obtained from health services. The medication record or log may be used to make notes of any additional comments or any unusual circumstances related to the student receiving the medication. Use only ink and never any whiteout when documenting on the MAR. Here's a copy of our MAR. This would be the form that the front office would utilize because only the school days in session are left blank. If you are a sponsor of a field trip and your trip would take place over a break, then you would need to contact health services for a blank MAR. Place corresponding signatures to your initials to the bottom left. Use documentation codes on the bottom right to fill in the boxes above. For a scheduled medication, there should be no blanks. Either the employee's initials or a documentation code would be found in each box. Here are the most common setting abbreviations that you might see in a school setting.